So many of you may be wondering, what is myofunctional therapy? I've never heard of it before, but now I'm hearing that it can help me. Let's start with the presentation and I'll answer a lot of your questions. What is myofunctional therapy? It's a series of customized exercises that address oral muscle dysfunction. These are known as orofacial myofunctional disorders. We aim to target improper habits and functions, enhance breathing and speaking. It's a more collaborative approach for holistic care. That means that you are being addressed as a whole person and not just your teeth or your nose or your throat. You are a whole person. You deserve to be addressed as such. Throughout therapy, we'll work on 4 goals. Our first goal is to establish nasal breathing. Mouth breathing is very tricky and it can show up and you don't even realize it's happening. We want you to be able to keep your lips sealed comfortably so you're not working to strain your lips and keep them together. We want the tongue up on the roof of the mouth and we want you to have a correct swallow. This means addressing tongue thrusts. This is a great picture to show how important tongue placement is. We want the tongue up on the roof of the mouth because, as you can see, if you don't have your tongue up on the roof of the mouth, the only place that it has to go is down and back, which impedes on your airway. The tongue is a very large muscle and goes all the way down to underneath your chin. Most people just think about the small part that you see in the mouth, but it's so much bigger than that. When the tongue is on the roof of the mouth, it helps to expand the palate naturally as you grow. It closes off the way to breathe through your mouth, so you have to breathe through your nose. When all of your muscles relax during sleep, your tongue goes down and back and it blocks off your airway. This is why you hear snoring a lot of the time. We are what we repeatedly do. Excellence then is not an act, but a habit. In myofunctional therapy, it's very important that we address habits. We've created habits as compensations. So all of these things can be changed. We'll work together to work on changing your habits and becoming more aware of what's happening with your body. What does dysfunction look like? This character, Napoleon Dynamite, is a fan favorite. He clearly exhibits all of the dysfunction that we're talking about. Mouth breathing, lips apart, tongue resting low on the floor of your mouth, and tongue thrust. Kind of hard to see that, but I'd be willing to bet when he swallows, he thrusts his tongue forward. He is exaggerating all of these, but that's what made him perfect for this role, and that's what makes it so funny. Common dysfunctions. The first picture on the left is how a lot of people look whenever they sleep, but don't think it's a problem. Even if you don't know this is what you look like, if you wake up and your mouth is dry, your lips are chapped, you've got a drool spot underneath you, more than likely, this is what you look like. You can see the second picture that his tongue is resting in the floor of his mouth, and you can see his lips are apart and it's not easy for him to keep them together. You can see in the third picture, same story. It looks like it's difficult for her to hold her lips together and her tongue is resting in the floor of her mouth. The fourth picture shows a tongue thrust. There's an opening where the teeth can't come together because the tongue is keeping that place apart. So every time this person swallows, their tongue goes between their teeth, keeping those teeth apart. So what's the problem? Why do these matter? What do dysfunctions cause? One of the biggest ones is sleep apnea. Many people struggle with this and have no idea that they do. It's like before you get glasses, you don't know that you can't see, and then you get glasses, and then all of a sudden, you're like, what? You guys can see all of this? This is crazy. It's the same thing. People don't know that they're not sleeping well until they do. TMJ disorders. This is something that happens a lot. People have a lot of TMJ pain and they think that there's no solution. They've tried night guards, they've tried taking pain relief medication, they've tried lots of things and nothing's helped. A lot of this is because of muscle imbalance that puts too much pressure on your TMJ. Orthodontic relapse. How many of you have gone through braces and had to get braces again? And then maybe again. This has to do with muscle dysfunction and imbalance as well. Our soft tissues decide what our hard tissues are going to do. So if there's muscle dysfunction, the bones are going to continue to move the way that they did originally before you had braces. So that's when you will continue to see the relapse until you fix the muscle dysfunction. Chronic facial pain. People don't realize that undue strain and stress on your muscles can cause facial pain. You don't know that's what's happening until it's fixed. Breathing disorders. Did you know that you could even be breathing wrong? It's true. You can be breathing wrong and it can be causing a lot of problems. There's many people that struggle with asthma and allergies and it continues to perpetuate and get worse because of improper breathing. Is myofunctional therapy alone going to fix all of these things? Probably not, but your myofunctional therapist, me, I'm dedicated to figuring this out, sending you to the right professionals to help you get taken care of as a whole person. This next picture is a wonderful illustration between a nose breather and a mouth breather. You can see a huge difference in the craniofacial growth of a nasal breather versus a mouth breather. Let's take a look. In a nasal breather, you can see the well-developed jaw, that protects the airway. You can see he looks well rested. He's got good facial definition, alert eyes, and straight teeth, even though they're not showing you the teeth. And this poor mouth breather, they didn't do him any favors by giving him a terrible haircut. But you can see he's got tired eyes, poor definition of cheekbones, and you can see that down and back craniofacial growth with the retruded jaw, which impedes on the airway. These are pictures of a client that I worked with who was 16, and her complaints were poor sleep quality, snoring, and difficulty breathing through her nose. She struggles with allergies and a stutter. With her, we did about 6 months of therapy and a lip tie and tongue tie release. She reported feeling more rested, easier time breathing through her nose, and significantly less snoring. You can see a huge difference between the profile picture. On the left, you can see her retruded jaw, a lot of tension throughout her mouth, and forward head posture. In the right picture, you can see an improvement in the forward head posture, a more defined jaw, and a lot less tension around her mouth. You can see it just looks like everything's moving forward. In the right picture, you can see that she's got better definition in her jaw, and even though you can't see her eyes, you can tell that she looks more rested. She reports that she was. So how do we get there? Therapy with me is 12 to 15 sessions, once every 2 to 3 weeks, depending on scheduling, and each session lasts for about 30 to 45 minutes, just depending. I have virtual or in-person appointments available, but I prefer in-person. As a myofunctional therapist, I will never be the only answer. I work with allied healthcare professionals to get you taken care of as a whole person. So this could be your dentist, be your primary care physician, an ENT, orthodontist, sleep specialist, or even a speech therapist. The final component is patient compliance. It's very important that you're compliant with your exercises. You could come see me once every 2 to 3 weeks for 30 to 45 minutes, and it will not change anything. The magic happens at home. So let's get started.
Bye-bye, people.
Bye-bye, people.
Bye, people.
Do myofunctional therapy.